The paper is called Surgical Premature Ovarian Insufficiency in Young Women. This is an issue that has not been widely recognized in our society. The story has to do with hysterectomy, and usually at the time of a hysterectomy, the ovaries are removed. The ovaries are removed to prevent cancer, and they do. So in fact, the original concept that when you were doing a hysterectomy, you would remove the ovaries, even if they looked normal, it was done as a preventative measure, and it indeed has been found that doing that essentially eliminates the risk of an ovarian cancer for the rest of the woman's life, and also reduces the risk for breast cancer. Our paper is collaborative. There are 3 authors: myself from Yale, Dr. Nelson, who is from the National Institutes of Health, and Dr. Sullivan, who's from the Food and Drug Administration. I think that's important. It's saying that people who have been thinking about these issues across the board have decided to give it a priority. In the year 2002, our major national study called the Women's Health Initiative published very negative findings that really had nothing to do with the young women having hysterectomy. It had to do with women who had a natural menopause, who were given a combination of hormones for treatment of their symptoms. And those women developed major problems, including increased heart attacks and stroke and blood clotting and breast cancer. So everybody became frightened. Well, it also affected the women who had had hysterectomy with their ovaries removed, who wouldn't have been given that combination of hormones. They would just be given estrogen to protect their bodies. But they stopped also. Within 24 months, half of all the women in the United States who were just taking estrogen stopped. But within 24 months, the Women's Health Initiative published positive findings for those women, that indeed taking the estrogen at a young age would reduce the risk for heart attacks, would reduce the risk for dementia, would reduce the risks for osteoporosis. There's a long list. But the second message didn't take. Everybody was so frightened by that first frightening message that, fast forward to the current scene, we now have literally millions of women who are avoiding estrogen at the time of their hysterectomy, who really should not be avoiding it. We looked at data in the best of journals, from the New England Journal to the Journal of Clinical Endocrinology and Metabolism. Even within the last year, there have been more than half a dozen significant papers saying that when a woman's ovaries are removed or she loses her ovarian function, the estrogen should be replaced as soon as possible. It should be maintained until she reaches the natural age of the menopause, and even longer. A minimum of 10 years is a good guidance for people to keep in mind. So what we have as our key points in our paper is, number 1, that we need to recognize a problem has been created among young women of not being well informed of the risks and benefits of surgery usually for solving a gynecological problem. It solves the problem, but then you have to do something afterwards. And if you don't replace the missing estrogen, then you have all of these complications. If you do replace it, you will eliminate those complications. And then the first thing we're always asked is, well, what about breast cancer? And there's a very clear-cut answer to that, I'm glad to be able to say. The first data is from the Women's Health Initiative, and it does say that women under age 60 who start estrogen within 6 to 10 years of their menopause, if they take estrogen, have a reduced risk, not an increased risk, for breast cancer. That's different from the original study of the hormone for women who had a uterus. So that, we call that the 800-pound gorilla in the room, that everyone is thinking, well, this is all great, except I'm going to get breast cancer. And the answer is, no, you're not. The story of hormones and breast cancer is a complex story. There are actions that estrogens have that make breast cancer cells grow, and there are actions that estrogens have that kill breast cancer cells. And the data we have from study after study after study is that the women taking estrogen, when they've had their ovaries removed along with their uterus, have no increased risk for breast cancer.